Hello, my name is Chanaza Mwabike. The healthcare system issue that we'll be discussing today is wrapped around patient care. What exactly is patient care? Patient care is services rendered by members of the health professions for the benefit of a patient. In this case, we will look more into preserved incentives and how we pay for care. Preserve incentives. What is it? Over the years, we have seen this topic slowly fade away, and that is patient care. From being a primary focus, especially with how we pay for care, in terms of preserved incentives, which is an incentive that produces an adverse consequence due to the action undertaken to receive the incentive. This has become a major issue in healthcare. There are two types of preserved incentives that we will discuss, and that is traditional and managed care. Traditional incentive is where maximize profits by overtreating, and this is basically why you get called back so many times to the doctor's office. You have producers telling consumers what they need, making you feel like you can't think for yourself and that everything the doctor says has to be true. The more they sell, the more they profit. At the end of the day, hospitals are also businesses. The sicker the patient, the more money they make. That is why it seems like we don't get cured. We just get treated. Because if you get treated, what's the point of going back to see the doctor? For you to get treated means that you're now cutting back and cutting off business production for that day. The next type is managed care. This is what I like to call band-aid, where you get patched up enough to get by. One example is patients change providers, so preventative care are not cost effective. This is because insurance will not know which doctor to pay since the same service is being rendered just through different doctors. Next, we have maximized profits by denying treatment. If copay don't cover doctor visit or prescription, they have to hold off on treatment and wait, which possibly by the time they come back, they might even end up in the emergency room, which is more money for the doctor because the treatment is now more severe than what it was before. Don't get me wrong, I believe every treatment and recommendation to any patient is for the purpose of their own benefit. But shouldn't considering costs also need to be part of that benefit? Doctors offer to see their patient for a certain amount of time in a year to where unnecessary appointments are made. For example, getting medication refills. There's some doctor's offices out there that will require the patient to come in physically in the office before initiating a refill instead of just calling for the refill over the phone. According to research, the US health system spends over 50% more than any other nation on earth on medical care, but our results and outcomes are in the lower half. Examples: newborns with congenital anomalies but no health insurance. According to research, newborns with congenital anomalies but no health insurance were 2.5 times as likely as those with health insurance to be transferred to children's hospitals because the birth hospitals want to keep the paying patients but push off those who cannot pay. Another example is insurers versus insured relationship is temporary. This is because the relationship between the insurers and the insured are frequently temporary. The insurance companies have little incentive to invest in the future health of the insured. For example, someone with type 2 diabetes or even terminal cancer. Insurance companies would rather not spend their funds preventing or even delaying the onset condition. Rather, they would prefer having clients who will stay healthier longer because that's more money for the insurer. Insurance will prefer going for clients who are less likely to need medical care than those who require it. Another example, paying physicians to provide services patients might not need. Physicians are provided the greatest reimbursement for the least time required. We are basically paying physicians for doing things. This is why you can walk into a physician's office and the number one recommendation he gives to your high blood pressure is losing weight and or changing your diet. List of solutions. First solution to this is paying physicians based on value instead of for doing things. In this way, doctors can actually make it their duty to cure rather than just to treat. This will even create and give more rooms in crowded hospitals for other patients to be able to be seen also. Another example is lower overall cost of healthcare system. This will eliminate patients not being able to afford the required medications and treatments that they need. From a personal experience, working in the health field, there's been situations where the doctor prescribed a patient a certain medication, but the insurance would deny it, and the patient then cannot get it, and the patient needs the medication. Insure everyone in our country is another example. Another solution, I'm sorry. Other countries has universal health care, such as Canada and the United Kingdom, where National Institute for Health and Care, also known as NICE, is able to negotiate their drug prices down. The federal government should work with other healthcare purchasers and payers to develop payment approaches that will remove preserve incentives and reward quality enhancement through information technology. And through information technology, we are even able to double check and even limit medication errors. In conclusion, I'll be closing with a quote by Dr. Robert Purr, which states, Dr. Robert Purr made a statement in an article in the Los Angeles Times, painting a bigger picture behind. Let me take a classic American background taunt and turn it around. The line is, if you're so smart, why aren't you rich? So, if the United States is so rich and so smart, why aren't we healthier? Thank you.